This series of podcasts on domestic violence during the pandemic in Sri Lanka is an initiative by the Centre for Equality and Justice in collaboration with the Forum Against Gender-Based Violence.
Welcome to the third episode of the podcast on domestic violence during the COVID-19 pandemic. My name is Haritha Chandrasehar and I'm a project officer at CJ. Today we are joined by Ms. Nilusha Gunathilaka, a clinical psychologist and lecturer. Nilusha achieved her MPhil or Master of Philosophy in Clinical Psychology at the University of Colombo. Welcome, Nilusha.
Thank you so much, Haritha.
Can you start by telling us the impact of domestic violence, especially during the COVID-19 pandemic, and the need for psychosocial support services during that time?
Yes, Haritha, actually the World Health Organization has identified that the domestic violence is a global health crisis. Imagine it's a global health crisis. And in Sri Lankan context, that we have done some statistics by the Census and Statistic Department in 2019 and have identified like out of 51%, 6% of women population, 20% were physically and sexually abused in Sri Lankan context. So imagine under such situation how much we needed that the mental health help.
Sure.
And also apart from that, it's not only the domestic violence, that the children also who were there at the premises were affected with that. And also the cost, when it comes to cost, Haritha, it is not only the family financial cost, but the social cost also accumulated to this context. So we can't disregard everything.
So what sort of mental health issues were most prevalent during the pandemic, Nilusha?
When it comes to mental health crisis, actually I have to start from the anxiety disorders. It's Haritha, it's because of like so much of uncertainty. No one knows that what will happen in the next moment. With that anxiety, like a lot of generalized anxiety disorders, exam anxiety, all sort of anxieties were there. And apart from that, the depression, it was really high during at that time because financial issues and the social issues and religious issues and a lot of things, crises were there during that time. And also apart from that, I identified that the OCD, obsessive compulsive disorder, which is the concerns with whether I will get germs and affected with germs and I will go through difficult times and recurrent thoughts and the images and like finding really difficult times. And in social context, when we see that actually the illicit drug use and illicit alcohol usage, it was really high in the Sri Lankan context and it has become a mental health issue as well. So there are kind of many issues during at that time.
Sure.
And apart from that, I wanted to add one thing really special one, that's the grievance and the grief. Because loved ones, when the loved ones were died and apart, we didn't have the opportunity to do the normal rituals. Because Sri Lankans are really people who knitted with the rituals and the part of the religious aspects and everything. Sinhala Buddhists, they have their own, if I call it Mataka Vasradim and those things, and the Catholics and the Tamil and the Hindus, they have their, and the Muslims, they have their own way of rituals, but they couldn't do any of those things because of the pandemic curfew and the lockdown. They were restricted there. With that, lot of issues were arise.
What are some of the mental health issues that were prevalent during the pandemic, especially for survivors of domestic violence?
Yes, when it comes to domestic violence, actually what we have identified was the anxiety, because a lot of anxiety were there, because they were restricted in one place and they couldn't go out, and what will happen in the next moment, they don't know, because a lot of uncertainty was there. So that domestic violence setting, that they were going through a lot of anxiety. It can be anxiety, generalized anxiety, and as well as the depression. because already they are in a suppressed situation there, and also like they don't know from where I can get help because the traveling were restricted. And these, it can be women or men or anybody, because that domestic violence, like there's no gender there, anybody can go through. So that the mental health issues that what they were facing during at that time the same, and the general mental health disorders like OCD, even we identify among the DV people who are going through the domestic violence, that has increased, even the OCD level. It means when people are going through domestic violence, all the other mental health related issues were really affected, highly affected there.
Yeah.
And the one more thing, because that we have identified illicit alcohol usage. Because of the illicit alcohol usage, again it's a mental health issues, as well as it has caused an issue for that domestic violence as well.
Yeah, there's a relationship.
Exactly.
Okay, so Sri Lanka already has a problem with regards to resources, right? In addressing this crisis, you call it a global crisis. So Sri Lanka already has problems addressing this crisis of domestic violence. So in a setting of the pandemic, how did we manage, or how did we address this problem?
Yes, so it is the one thing is the government, how the government address the problem. So that when it comes to domestic violence, like first of all, we have to see like how the pandemic were run out the first 6 weeks. It was like we were going through the curfew, pandemic curfew. At that time, even the government were like settling everything, and they were putting all their resources related to the COVID-19 pandemic and the physical health related issues.
Sure.
And at that time, I don't see much of the domestic violence related approach by the government. And at the same time, because that how the government approached the domestic violence is based on the Mithrupiyasa. But at that time, because of the lockdown and the limitation of the traveling, and we didn't have public transport, so people couldn't go to the Mithrupiyasa as well. And the Mithrupiyasa staff themselves, they couldn't go to their working place or arrange themselves.
Right.
So that during the first 5 to 6 weeks, actually, it is unfortunate, but I have to tell that nothing was highly happening related to domestic violence. But after that, after the first 6 weeks, that what we have identified was the increase of the domestic violence and the escalation of the domestic violence. So because of that, again the government policy changed the bit of the traveling, like linear was there. So that time again the Mithrupiyasa was there, they were activated, but again the social distance and the people fear, even though they were going through domestic violence, they were really fearful to reach out to the Mithrupiyasa.
Okay.
So that was our situation according to the government setting. But that is where the civil society organization comes actually.
Okay, so what was the role of the civil society organizations in providing services, especially because there was an increased demand, right, during the COVID-19 pandemic, so in addressing domestic violence. So how did the civil society organizations meet with this demand?
Yes, exactly. Because civil society organization, actually for them also this is a challenging period, because nobody knows like how to handle this period. And the civil society organization, how they used to handle domestic violence related aspects were like the counseling setting, that awareness building programs and those kind of areas. So that they have their own limitations there, because we didn't have any like aspects or that the developed program how to handle domestic violence online or through the phone, and we didn't have set of ethics for that.
Yes.
But that during that period of time, like civil society organization, I know that they got together and they were taking advice from the Ministry of Health, and they developed the actually the ethics process, and also the how to address domestic violence online. Because it's a really risky thing, because it's not some other ways of doing counseling. domestic violence victim is at that place and the perpetrator also at the same place, so that it is not just calling and online connecting and asking okay whether are you doing okay, because the perpetrator is at the same place, that the victim there's a chance of getting beaten up again. So that we have to handle and train our civil society organization members, and they did really pretty good job. It's because that our government couldn't handle all the area. What they did was like the women in need and the family rehabilitation center and the family planning organization, and what they did was actually it's not only in Colombo setting but the out of Colombo area, northeast and the far away Badulla, Anuradhapura, far away from Colombo, and they reach out to those people with their phone numbers, and they develop new plan how to achieve those, because at least to give them the idea we are there for you. Because of the pandemic we are not going to leave you kind of thing, and they developed actually the contact list, and they contact these people with the secure environment and they provided the services, and this is a new way of providing the services, but they have done pretty good job.
During the pandemic and the lockdown, clients who were normally able to access their health provider faced, as you said, a severe barrier to this. So those who accessed private medical health care were able to get on board the telehealth options or the virtual health or virtual consultation options. But this is not a service that was available, if I'm not mistaken, a service that was available for those who sought government health care support, right? So how did we manage this difficulty? What did we do?
So during the pandemic time, actually the government services were acted pretty quickly. I would say in April 2020 they started a helpline. That's the National Emergency Response Trilingual Hotline 1390. And people were able to reach out to this hotline, and it is not only the physical health related issues but this is related to the mental health as well. And they were able to, this is free of charge hotline, and apart from that the National Mental Health Helpline, that 1926 were operated there. So those are the two helplines that we can identify with that period of time where our public can reach out to. And I would say rather than those, like much of the work couldn't happen with our resources and the other limitation. But as you said, of course, like the private hospitals and other methods, like they have very advanced method, they use advanced methods. That's true.
Thank you, Nilusha, for that really insightful discussion on domestic violence, services for domestic violence during the pandemic.
Thank you, Haritha.
Keep watching until the end of the episode to find out more information about the hotlines available for survivors of domestic violence. Thank you.